Hi, and welcome to CMO Journeys. I'm Christian Benak, and on the show, I talk with marketing leaders behind some of today's most interesting brands. We get into their career paths, how they think about marketing, and how they work with agencies. Cooper University Healthcare is one of the major academic health systems in South Jersey, serving patients across hospitals, outpatient offices, urgent care, specialty care, and advanced clinical programs. It is also in a big growth moment with major investments in Camden, ambulatory care, and innovation. That makes Tom Rubino's perspective especially interesting because he sits at the center of brand communications, reputation, patient growth, internal alignment, and the future story Cooper is trying to tell. Tom, welcome to CMO Journeys.
Thanks for having me. Pleasure to meet you.
Likewise. So this is CMO Journeys, so I'd like to talk about your background to start. So growing up, I'm curious, were you someone that was more of a planner, a risk taker, a storyteller, builder, something else?
I don't know. As a kid, I just liked to be outside and running around and playing a lot of sports growing up. So it wasn't really a planner, I don't think. I just was out to have a good time and enjoy friends. I had a lot of friends. We spent time in the neighborhood, riding bikes. I was a big skateboarder back in the day.
Okay.
That was really, I wasn't a planner or anything like that. I think I was just more of let's go out and get some exercise and be outside.
Yeah, yeah, sure. So you mentioned skateboarding. I mean, was that something you competed in, or was it more just for fun? Or tell us a little bit
No.
more about that.
Yeah, it was more for fun. And I was the first, I guess, when skateboarding really got big in the late 70s, early 80s. The Lords of Dogtown, that group back in California. So that was when I was skateboarding, and we just went to skateboard parks, and we built a skateboard ramp at my friend's house, and it ended up at my house. And so we would spend hours just skateboarding, and it was just a lot of fun.
Sure.
So I
Yeah, I was
enjoyed
recently out in Venice Beach, and they got a number of different,
it.
skateboard parks there. It's
Yeah, well,
so cool.
that was Lords of Dogtown back then, right?
Yeah,
That was
yeah,
so Stacy Peralta, all those famous skateboarders back in the day. Yeah,
absolutely,
it was
absolutely.
fun,
So,
a lot of fun.
yeah, so you mentioned skateboarding, but was there anything else maybe unusual about how you grew up that, looking back, you feel like might have shaped a little bit about who you are today?
Oh, sure. I mean, I had a great childhood and growing up, a lot of fun. Friends. I think it was more building relationships with folks is something I always tried to do, and I think that has helped me throughout my career. And so I think that's always a key part. And for marketing in particular, building relationships, understanding how people respond to observing people, what they like, what people are attracted to, and how they react to certain things. So I think that was part of it that helped me. Um, and then growing up, and as I got a little later into maybe high school, but even before that, I enjoyed politics.
Hmm.
My father, I would watch the news with him even when I was very young. So I think that started early on, and so I enjoyed politics and got involved very early in life, and went on to be an elected official in my early 20s, and so it was fun, and that's sort of I think that was sort of an interesting background that had me looking into how do you persuade people, how do people come to power, and what does that entail? So I would study that, and I think that's sort of where it got me into marketing.
Yeah, yeah. So let's go deeper on that. So you mentioned you'd started in law, you worked in public service and
Mhm.
politics before moving into these communications and marketing roles. You mentioned persuasion. When did you sort of first realize that persuasion and message discipline might be a real through line maybe through your career?
Yeah, well, I wanted to go in high school. I decided I wanted to go to law school because most people in politics had a legal background to understand the system, and so that was what I sort of was focused on, and part of that is communicating, right? So even as an attorney, you have to persuade, and so I early on I understood that how you communicate, how you develop a message to persuade folks is important. And so I was early on, from a legal perspective, thinking about that. I had no idea that I would be in marketing. That was not my career path at all. I had, it's like I said, I wanted to be a lawyer and then be involved in politics in some way. And so that was my mindset, and I really wasn't thinking about marketing. But now, as I look back, it was perfect training for it. I think it really has helped me to build a logical case, to build a logical message that can persuade. And I think that's, and also taking complex issues and narrowing them down to bite-sized messages that people can understand is an important skill.
Yeah. So how did you make that leap?
Yeah.
And what did that feel like? Did it seem like a natural extension? Did you seem like you were in over your head maybe at first? Like, tell us about how that transition happened to marketing.
Yes. So it's interesting. I was involved, as I said, I ran for office at the age of 26. I lost my first election. The next year I ran again and won, and I was served as deputy mayor in my town. And then I was running campaigns. I was doing all of the public relations. I was writing TV commercials. I was writing direct mail. I was doing all aspects of campaigns. And then I was working for someone who was thinking about running for governor. I stayed with him for a number of years, and I helped him run his third term election to a county office. And then he decided to, retire. So then I was sort of looking for work, and it was, after election night, I had a few weeks. I had like 6 weeks to find a job, and I had a 2-year-old daughter and one on the way. So it was, so I was just looking, and it came up rather by chance that a health insurance company, the largest one in New Jersey, was looking for public relations person's director. So I applied, and through friends that knew people there, I interviewed, and I got the job. I had no healthcare experience. So when you say, did you hit a moment where you're like, what am I doing? Yeah, when I took that job, and I started in the midst of a major battle between two hospitals, one down here in South Jersey and then one up in North Jersey, and they were in contract disputes with the health insurance company. And that's how I started. My day one, I think I was up in the CEO's office. They were doing full page ads against our company, and I was put in. And I was like, "Help us solve this," So I was thrown right in the fire there, and had to learn very quickly, healthcare and all the ins and outs, and how to persuade folks quickly. So it was interesting, but there were times where I said, what have I done?
Sure.
But I love that kind of challenge, because I love to learn new things, and that was one of the things that was great about that experience, and learning it quickly and just delving in. So it was fun.
Yeah, sure. So you then would go on from the payer side to the provider side at Cooper. That also feels like a shift, and I'm curious, like, what did that jump feel like? What did that feel like for you?
Yeah, again, that was a major jump. The provider side thinks the insurers are the big evil empire, and the insurers are saying, well, no, the providers are part of the problem here. So you're jumping from one side to the other. So it's interesting. It's just been it's been really it was another learning experience, right? Because you're looking at things from a totally different side, and I had no clinical background, so now I had to learn a little bit more, dealing with physicians, how to speak with them, how to get messages from them to, when you're looking for new patients, and how can we use their message, and how to make them not speak clinically so that people can understand what what they're saying in a way that is persuasive. So it was a big learning experience. Again, I love that. You get thrown into something and you have no choice but to learn it, and so I enjoy that kind of a challenge. So it was fun. It was challenging. Healthcare has a lot of acronyms and a lot of its own language, which can be very confusing. Sometimes I'd be sitting in meetings where they'd say some acronym, and for 5 minutes I'm trying to figure it out, and I missed what was going on for So that's sort of the challenge. You have to learn those things quickly, but it was fun, and again, just learning how to speak the language, and then also take those complex ideas and then be able to transmit it to the public and to potential patients is a challenge and fun.
Yeah, yeah. So you've now spent, it looks like, a decade at Cooper, but your
Yes.
title, somewhat recently has evolved into Chief Communications and Marketing Officer.
Right.
And do you see this as a new chapter for you there, or merely a reflection of the role you probably were already playing?
Yeah, it's more of a reflection of the role I was already playing. But, so I have a sort of wide breadth of, that I handle, that I oversee. Just I have the public relations, I have the internal communications, we have the website, the social media, all of the brand marketing, and so it's a lot, and it's again, it keeps you on your toes, and it's a lot of fun. So I enjoy every aspect of that. I came out of the political realm, able to handle a lot of crisis communications with PR, and so I've done a number of those things. In campaigns, you have to be prepared for anything. I was a press secretary for a U.S. Senate candidate, so that was a little bit crazy here in New Jersey, and so you have to be on your toes for anything when it comes to PR. Although I prefer more the marketing and the advertising end of things, I've always preferred that, but I have a lot of experience in the other. And then, internal communications is a whole nother animal that you have to be on top of too. So I find that having a wide range of things that I'm doing on a daily basis makes it a lot more interesting and fun.
Sure, sure. Keeps you on your toes, like you said.
Yeah, absolutely.
So Cooper is expanding at a big moment for healthcare in the region, especially with Project Imagine, the ambulatory growth I mentioned, and regional, care disruption that's going on. Where are you feeling the most pressure from a marketing perspective coming from now? Is it something like patient growth or physician alignment, something else?
All the above. I think the biggest thing, we're in a very competitive market, so we are the only academic health system in South Jersey. We are right across the river from Philadelphia, where there's a number of big academic health systems, and so and they are moving into New Jersey. So we have competition from them. We also have other community health systems that are pretty big. So we're in a very, very competitive market. But as you said, we are growing. We have been growing for the last 10 years, and really have really transformed basically the public perception of our health system. 10 years ago, people would have said, "Well, Cooper's an academic is a urban trauma center, not an academic health system," and we've had to change that perception. We are affiliated with Cooper Medical School of Rowan University. Our physicians are the faculty there. And we have tons of specialists, and over 95 different specialties. And we are also the busiest trauma center in the region, including the Philadelphia hospitals. We have almost twice as many traumas per year because we have all of South Jersey. So it's a really interesting place, and in fact, our trauma center trains military trauma teams. before they go out abroad. It's an interesting. We have so many great stories to tell. It's hard to tell them all.
Right.
But that's part of the challenge. And but again, I think the competitive landscape is where it's most difficult. We're also seeing pressures from the federal government cutting back. 1.15 trillion cuts over 10 years coming up. So you're dealing with that, and then reimbursement from even commercial payers. They're feeling the heat too, and a lot of them losing money. There's a lot of challenges on the horizon, and so we're just trying to make sure that we communicate with folks as to what we're doing, the life-saving care that we're providing to folks, and all of the options they have when they can come here. So that's part of the challenges that we're dealing with, but those are the biggest, just the competitive marketplace we're in.
Yeah. So given all that, as you look ahead, where do you expect to be increasing spend, say over the next 6 to 12 months, and what needs to be true for that to justify really that investment?
Yeah, I mean that's part of the challenge because the budgets are tight, and we'd love to be spending more, but you can't always. So you have to use what you have as effectively as possible. So we actually do broadcast television ads in the Philadelphia market, and we do that for our cancer center and our brand overall. But mainly we have MD Anderson Cancer Center at Cooper, so we're partnered with the number one cancer center in the nation. So we have to let people know that, and we've done that. We've built that brand here in this market. They're number one across the nation, but nobody knew them here when we partnered with them 13 years ago. I think 8% of the market knew the name, and so we built that. And so we'll spend on TV, but it's more now. Digital, social. We're spending, I think, more in that connected TV really as well. We're seeing a lot of good engagement and in YouTube as well. So you have to find these niches where things are working, and you have to test a lot of those things, and we do that. Coming from the political world, I know the value of research, so we do a lot of focus groups on our messaging, on our ads against our competitors to see what is resonating and what really moves people, and I think that's a key to our success. We've been very good at doing that and trying to really hone in on messages that are persuasive and just move people. So we've had a great run, and I think the key to our TV, which has been effective, has been the balance between the emotional story. So you're telling a story in 30 seconds of an emotional, as you know, healthcare can be very emotional, but you're telling that emotional story and trying to show the relationship between the patients and the physicians and the compassion that's there. But also you have to give them the facts of, what you offer, what technologies, what, clinical trials, all those things that are important to folks. So it's a combination, and you have to really walk that line in a good, strong way.
Yeah. So you have a wide remit, it definitely sounds like, and budget constraints. Where do you see, though, as the biggest gap maybe between what the business needs now and really what the current operating model can support?
We're trying. Obviously, you always just want more resources to do a lot more, a lot more. But I think overall, we just want to have enough resources to make an impact on. I think digital, obviously, social has been very important for us, and I think it helps you tell a little bit longer story sometimes, and so we do a lot of video on social media that gets good engagement. You could tell a little bit more of stories. And then we also use those videos on our website where people come to get information. So I think, I don't know if there's any real disconnect. It's just a matter of being able to make the case that if we're going to grow and continue to grow, we need to have those resources to tell people what we have out there. You can build stuff, but if they don't know about it, they're not going to be able to get there. So it's that balance, and I think that's the critical thing that is incumbent upon us to try and persuade folks. And I have built a lot of good relationships with the different service lines, and so they also say, hey, if we're building this, we need the marketing component because we can't, we're not going to hit our numbers if we don't have that ability to tell our story. And so we have a lot of good relationships with folks across the health system to do that.
Sure. Yeah, obviously as the host of this show, I speak with a lot of CMOs, and many are experiencing a lot of the same challenges that you're having. I'm curious if you were to be able to curate a group of the smartest marketers out there for an off-the-record discussion, what's a topic that you would want the room to help you think through?
Yeah, I guess everybody's talking about AI, and the most effective uses for it, I guess, would be something that I would be interested in. And then again, just for in the healthcare realm, if I was talking to some of the top health care CMOs, seeing what they are, what they're understanding the public is feeling, and what they're misunderstanding or where they're not clear on how health systems are there to help. I think there's a lot of anxiety in healthcare or in the public right now about healthcare. The costs are ever increasing, and that's a challenge for people to understand where those costs are coming from and how it's affecting them and why. And telling that story is not easy. And then you have within healthcare, the insurers and pharma, and everybody's pointing fingers, and so that makes it challenging too. So you have to sort of walk that line. But I think those are the top things. Obviously AI is big, but I would love to see what use cases are really working for people. I tend to think a lot of people talk about it, but I'm not sure that there's actual real good use cases that I've found for, other than the productivity. I think I use it all the time, and we have our team using it all the time to make our work easier, help us work quicker, help us come up with ideas quicker, test those ideas quicker. So I think it's a powerful tool, and I would just love to pick some brains that are smarter than me that what they're using it for and how they're using it effectively.
Sure. Yeah, I feel the same way. I hear a lot of people using it, but what are the bigger use cases and
Right.
bigger case studies of it, other than some of the productivity things that I think has become almost par for the course now, right?
Right.
So,
Yeah.
I'm curious, with all the work that you're doing, right now, what does your internal team look like? Are you leaning on any outside agencies or partners to help you bring this to life? Like, talk a little bit about that.
Yeah, so our team is small but mighty. Obviously, with in healthcare, not for profit healthcare, you don't have a huge team. But so I have a marketing team. I also have website team and social media, which is really one person on our social media. She's great. We have a couple other people help her, but we have a director who does pretty much everything, and we do have an agency that helps us out as well for some of our social and digital marketing. I do have a brand agency as well, and then we also have other agency for SEO, and they help us, with our website, and they've been pretty good. So we have a mix of internal and external. I do use the external agencies for those pockets where we just don't have that expertise, or we just need help because we don't have enough folks. And we have a really good mix of agencies, and I think our brand agency, which we went through an RFP a few years back, and they came in really understanding us. They did a lot of good research, and they came up with a uh, great campaign for us, and we're using it. We continue to use it, but they came up with it, and we all loved it right away. It just spoke to us, and we're like, that's what we've been looking for. So that creative agency that has creativity, has a team that can really develop fine tuned messages. And we found that with this agency, and they had a little edge to them, a little humor, a little sarcasm in some of the ads. And we were like, we like that because you got to stand out a little bit. So use a little bit of humor, um, and they were able to do that and cut through what some of the other agencies that seemed to just, it was sort of what we had expected we were going to get, and didn't stand out. I mean, they were good agencies. They had, good presentations, but it just didn't stand out for us. And I'm really, as I guess you can tell, I really focus on messaging, and when somebody just cuts through with clear, compelling, like, it stood out, and everybody immediately said, yeah, that's the agency that we like. And it's been a great partnership, so I really enjoy working with them.
Yeah. When you mentioned a couple different agencies, where do you sit sort of on the argument of specialization versus, say, full service capabilities? Are you looking for agencies that are best in breed in certain disciplines of marketing, or specialists in certain industries like, healthcare and hospitals? How do you think about that?
Yeah, I do. Think the folks that specialize in different things, if they're a digital agency and they know what they're doing, and that's helpful for us, because I don't want a general agency that I can do some of that. I want somebody that's really specialized in that. So I think that's an important. I think it's important, and that's what I look for. Our brand agency is more of a general agency, but they do have healthcare background, which is really important because, as I said, there's a whole different language and a whole different world. So it helps to have that background. But I wouldn't rule out an agency that doesn't have healthcare experience if I can see a spark within them, because anybody can learn it if they're a smart agency, if they know what they're doing technically, and they just have a great creative minds. And so I don't necessarily rule that out, but it does help in terms of healthcare, just knowing it. But again, I think the tactical specialization is really the key for me, because we need that help, and I want the experts that really know that business well.
Sure. Yeah. So as you look at the challenges that you kind of outlined that are ahead, where do you see maybe your existing partners or other outside partners making an impact for you moving forward?
Yeah, well, I think the challenge is standing out in the crowded marketplace. So that's where I rely on the brand agency to come up with some great ideas. We bounce ideas off of each other. I love agencies that come with, it may be crazy ideas, but just coming with ideas so we can say, yeah, that may be too much, but yeah, there may be an idea in there. So I love that, and I love that interaction. They're just always thinking of new things, new ways to help us. And so I think for our creative side, that's going to be a key component to help us differentiate ourselves in a crowded marketplace. And so I think for me, that's going to be top tier. And then, the other agencies, again, what can you do to help us win patients, increase patient volume, but you're not going to get more and more budget. So how do we do it effectively? How do we really make sure that we're optimizing everything that we're spending? And so I lean hard on the agencies to, like, okay, you're telling me I got impressions. That doesn't mean something. Show me how it's working. How show me which ads are really performing. Are they converting? I don't want to just know all of those, fancy numbers and a dashboard. I want to know, like, where are we, most effective? Are we testing it? How are we testing it? What's making the most, bang for the buck? And so I think that's where we focus a lot, and I'll be leaning on the agencies to help us do that.
Absolutely. Yeah. So I think that's a great way to end here. Thanks again for the conversation and the insights. To everybody watching, don't forget to follow CMO Journeys for more conversations with the marketing leaders that are shaping what's next. I'm Christian Badak. Thanks for tuning in, and we'll see you on the next episode.